Hi, happy people. I'm Dr. Sandra Brown. I'm an ophthalmologist in North Carolina, and I'm here today to talk to you about managing your high eyes. This is a patient safety initiative of the Dry Eye Foundation. First, a little bit about me. I'm an ophthalmologist, which means that I'm an MD. I went to medical school and graduated, and then I did advanced training in medical and surgical diseases of the eye. I'm the medical advisor to the Dry Eye Foundation. I don't use cannabis in any form myself, but I understand the chemistry of it and how it affects your eyes, and I definitely understand how to manage red eyes. So let's dive in. First of all, why does the Dry Eye Foundation care about cannabis users? Well, we do not want you to be the next chronic dry eye patient or chronic ocular surface pain patient. These are patient photos which were uploaded to one of our websites, Dry Eye Talk. And these are very unhappy eyeballs. And never forget that those eyeballs are attached to real people, real dry eye patients. And those dry eye patients can have their dry eye take over their lives, affect every aspect of their lives. Not only is dry eye physically uncomfortable, but it can cause tremendous emotional distress and financial strain. We do not want this to be you. So keep listening. Because you may be future dry eye patients for many reasons. Diving into part one, why do I get high eyes? First of all, what's a high eye? Here's 4 great photographs of people that are high. I know these people are high because I Googled photographs, high eyes, and they came up under that Google search. So they don't have allergies, they don't already have dry eyes, they don't have pink eye like an infection. They're high. This is how you look when you're high. You know it, I know it. How to fix it the right way. That's what we're going to be discussing. What are some myths about high eyes? I got a pretty good laugh out of this during my research. Myth number 1, cannabis lowers eye pressure, which increases blood flow. Myth number 2, cannabis lowers blood pressure, which increases blood flow. Nope, that is not why your eyes get high. This is why. THC gets into your bloodstream. That's where you want it, right? You want it to get into your bloodstream and then go to your brain and make your brain very happy. It's not just the smoke that gets in your eyes. As most of you probably know, high eyes happens with edibles too. After the THC gets in your bloodstream, it goes to a variety of places. One of them is your brain, which is where you want it. It makes you happy, and that is great. But it also goes to the blood vessels on the surface of your eyes, and it causes those blood vessels to dilate, which is to say they get larger and more blood flows through them. But this has nothing to do with blood pressure or eye pressure. It's a direct effect of the THC on the blood vessels themselves. I checked with Google, and Google says high eyes is an issue. I tried how to get rid of high eyes, and I was astonished to see that there were 526 million hits. I tried how to get rid of stoner eyes, and that picked up another 2.4 million hits. So you all have a serious concern about this. How does Dr. Google treat high eyes? The number 1 recommendation is to use a redness relief eye drop. Other recommendations included cold compresses, hot compresses, tea bag compresses, artificial tears, not redness relief eye drops, allergy relief eye drops, and actually a recommendation, which is not totally irrational, blinking a lot. How does a redness relief eye drop work? Here's an example of what you want from that eye drop. On the left, before the high eye. On the right, after the beautiful, white, smooth, shiny, glistening eye, not giving anyone a clue as to what you've been up to. Vasoconstrictor means blood vessel shrinker. So there are active ingredients in these eye drops that contact the blood vessels on the surface of your eye and stimulate them to shrink. THC is making them enlarge. The vasoconstrictor is making them shrink. It's just a matter of which molecule is going to win. And here's why the Dry Eye Foundation wants you to pay attention to these little PowerPoint lectures. Because those of you who frequently use vasoconstrictor eye drops might be asking yourselves from time to time, or perhaps frequently, why are my eyes still red? Or why are my eyes red again? And if you're asking yourself these questions, you're heading for trouble. We'd like to help you back away from that trouble. This is the end of part 1. For additional resources and support, please see the following web pages.